Hello guys, welcome back to my channel Start Life with Physio. Today our topic is oculomotor nerve, trochlear nerve and abducent nerve. If you guys have not checked out the previous cranial nerve videos for the first and the second cranial nerve, it's on my channel. You guys can go through it. So in this video we will be discussing about the three cranial nerve, which is the third, fourth and the sixth cranial nerve. Let's quickly begin with the topic. Oculomotor nerve, this is purely motor in nature. Its function is it supplies the levator palpebrae superioris and superior rectus muscle, medial rectus, inferior oblique and constrictor pupil, and also the ciliary muscles. So this nerve supplies the following muscles, which is the medial rectus, inferior oblique. It function is also to lift the upper eyelid. It turns the eyes upward, downward and medially. We need to remember this point, that oculomotor nerve is responsible for turning the eye upward, downward and medially. Medially is towards your nose. And it also is responsible for constricting the pupils and for the accommodation of the eyes. As you can see here, if the oculomotor nerve is effective, it is called as oculomotor nerve palsy. And if there is oculomotor nerve palsy, this is how the person's eye looks. There is, as we told earlier, it is responsible for movement of the eye upward, downward and medially towards your nose. So if the nerve is getting damaged, there will be lateral or outward movement of the eye, as you can see here. So it is always the opposite of what the nerve gets damaged. Next we have the fourth cranial nerve, which is the trochlear nerve. Trochlear nerve is motor in nature. Its function is that it supplies the superior oblique muscle of the eyeball, and it also assists the eye in turning the eye downward and laterally. Trochlear nerve is responsible for movement of the eye downward and laterally. Laterally is away from the body, that is looking outside. So when there is trochlear nerve palsy or damage to the trochlear nerve leads to trochlear nerve palsy, this leads to the paralysis of the superior oblique muscles that takes the eyes down and in, because of which there can be vertical diplopia. Along with this, there will be head tilting to the opposite shoulder, and this is known as Bill-Schuhe sign. As you can see here, this is the Bill-Schuhe sign because of the trochlear nerve palsy. Next we have the sixth cranial nerve, which is the abducent nerve. Abducent nerve is motor in nature. Its function is that it supplies the lateral rectus muscle. Here the abducent nerve is supplying which muscle? Lateral rectus muscle. So its function will be to turn the eye laterally. So if there is damage to the abducent nerve, this will lead to abducent nerve palsy. As we know, the work of the abducent nerve is to turn the eye laterally. If there is damage to the abducent nerve, this is how the eyes will look. The eyes will turn towards the medial side because of the damage to the nerve or the weakness of the nerve. This leads to the paralysis of the lateral rectus that takes eye laterally. The affected eye deviates medially, as you can see here. Turning the head towards the side of the parietic muscle overcomes the diplopia. Ocular muscles, we have the superior rectus, inferior rectus, lateral rectus, medial rectus, inferior oblique and superior oblique. As we discussed in the previous slides, these are the muscles, and we know that which muscle is getting affected because of the nerve involved. Purpose of examination. First thing is that to inspect the pupils and to determine if there is any abnormality due to the local disease, peripheral autonomic lesion or any nuclear involvement in the brainstem. Second thing is to examine eye movement and determine if there is any defect of the local muscular origin, lesions of the ocular and motor nerve. Also to understand or to detect the nystagmus. Inspection. Okay. Look for the following signs whenever we are doing the examination for these three nerves. These three nerves are always examined together, which is the third, fourth and the sixth cranial nerve. So first thing, we need to look for ptosis. Then we have squint. Then we have hypothylamosis. Then we have hypertelorism. These are the four things. Let's quickly see how does it look like. This is how the ptosis look like. Ptosis is nothing but drooping of the eyelid. This can be seen on one eye, or it can be in the both the eyes. As you can see here, it can be unilateral or bilateral. Ptosis is drooping of eyelid. Squint. Squint can also be unilateral or bilateral. Squint is nothing but the inward or the medial movement, or the medial, when the patient is at rest, there is internal rotation of the eyeball, as you can see here. It can be on one side or it can be on both the side. Accommodation reflex. This is the important test to check the nerve, that is the third, fourth and sixth cranial nerve. In accommodation reflex, afferent impulses are by optic nerve and efferent impulses are by oculomotor nerve. Pupil constriction and medial recti contraction brings out the focusing of the object. Here the patient is made sit, then the therapist places his finger in front of the patient, and the patient is asked to focus on the fingertip. Then the therapist quickly takes the finger towards the patient and should take it back again. This is repeated for 2 to 3 times. Then the movement of the eye during this procedure is observed. If there is any deviation of eye than focusing on the finger, and if there is any nystagmus, the test is considered positive. Normally, if there is no if the accommodation reflex is negative, when the patient is normally focusing on the finger and is able to rotate the eyes or constrict the eyes depending upon the distance of the moving finger. Next is diplopia. Diplopia can be horizontal diplopia because of the abducent nerve palsy. Vertical diplopia occurs because of the trochlear nerve palsy. Due to the imbalance in the extraocular muscles, two images are formed in the eye. This is nothing but diplopia. Okay. So next we have is nystagmus. Nystagmus is the balance of tone between the opposing ocular muscles is influenced mainly by the impulses from the retina, the muscles themselves, vestibular nuclei, and the central and the peripheral connections. And also the proprioceptive impulses, which are from the neck muscles. Nystagmus is nothing but the abnormal movement of the eye which occurs, or it can be also named as abnormal jerky movement of the eye. Nystagmus can be horizontal nystagmus, that is the movement of the eye side to side. It can be vertical nystagmus, that is movement of the abnormal jerky movement of the eye up and down, up and down. It can also be rotational nystagmus. These are the types of nystagmus which can be observed. Any one type can be seen. Alright then, by this we come to an end of the topic cranial nerve examination for oculomotor nerve, trochlear nerve and abducent nerve. Thank you so much. Like and subscribe to my channel Start Life with Physio.